The measles resurgence, a 2025 nightmare unfolding. The year is 2025. A chilling resurgence of measles, fueled by vaccine hesitancy and misinformation, is sweeping across the United States, shattering the complacency of a nation once declared largely free from this highly contagious disease. The numbers are stark, painting a grim picture of a public health crisis unfolding before our eyes. While last year saw a relatively manageable 285 cases nationwide, the first few months of 2025 have already witnessed a staggering 378 confirmed cases, a surge that surpasses even the most pessimistic projections. Texas has become the epicenter of this outbreak, bearing the brunt of the crisis with a staggering 309 confirmed cases. The human cost is devastating. 40 hospitalizations and one tragic death, a 6-year-old girl, unvaccinated, succumbing to the disease, underscore the potentially lethal consequences of this preventable illness. The heartbreaking testimony of the child's parents, featured in a video released by the anti-vaccine organization Children's Health Defense, only amplifies the tragedy. Their statement, "We would absolutely not take the MMR," reflects a dangerous disregard for established medical consensus and scientific evidence. Their claim that their other children got over it ignores the potential for serious complications, even death, associated with measles. The outbreak's relentless spread has extended beyond Texas borders, infecting communities in New Mexico, 42 cases, 2 hospitalizations, 1 death, and Oklahoma, 4 probable cases. The virus's insidious reach is further evidenced by new cases reported in Ohio, 1 case linked to international travel, Maryland, 2 cases, also linked to international travel, and Alabama, 1 unvaccinated child traveling through the state. Kansas has also confirmed 8 cases this month. Other states grappling with the resurgence include Alaska, California, Florida, Georgia, Kentucky, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, and Washington. Catherine Wells, director of Lubbock Public Health in Texas, poignantly captures the unsettling reality. "I never thought in 2025 we would be looking at this resurgence of measles, and I didn't know it'd be in my backyard either." Her statement resonates deeply, encapsulating the widespread shock and concern sweeping across the nation. The alarming increase in measles cases raises troubling questions about preparedness and response mechanisms. The timing of this outbreak is particularly concerning, occurring shortly after the U.S. government placed thousands of USAID employees and contractors on leave. Many of these individuals worked in countries with high rates of measles, potentially contributing to the increased risk of imported cases. Adding fuel to this public health fire is the pervasive spread of misinformation and vaccine hesitancy. Robert F. Kennedy, Jr., a prominent figure associated with the anti-vaccine movement, has fueled this dangerous trend, albeit indirectly. While avoiding explicit recommendations against vaccination during this outbreak, he has promoted alternative treatments and made unsubstantiated claims about the health of the deceased Texas child, stating she was unhealthy or malnourished, despite official medical reports confirming her health. The situation is dire, demanding an immediate and comprehensive response. The stark reality is this: measles is a preventable disease. The MMR vaccine is safe and highly effective. The current outbreak underscores the urgent need for increased vaccination rates, robust public health education campaigns to combat misinformation, and improved surveillance systems to detect and contain future outbreaks. Ignoring the science and succumbing to fear-mongering only jeopardizes the health and safety of our communities, perpetuating a cycle of preventable suffering and loss. The time for action is now. The future health of our nation hinges on it. The tragic consequences of inaction are already being felt, and the escalating numbers demand immediate, decisive intervention to prevent further suffering and loss of life.